So we are live now, Chandan.
Yeah.
Okay. So, good evening to all the live viewers. Today, I am very happy to share that we have very experienced and talented Dr. Sudhanshu Shekhar Bhoi with us. Dr. Bhoi has done his DM from SSKM IPG MER Kolkata in the year 2019. Sir has been a very meritorious student all around and has passed his 10th and 12th with great grades. Sir has done his in work experience, he has also worked in Medanta, Delhi as a SR from September 2014 to April 2015. Sir has work experience of general nephrology, dialysis, hemodialysis, and CAPD. Also, sir has got experience for vascular access creation and management, renal transplant, and post-transplant care. Sir has got experience of conducting more than 50 live donor renal transplant as a part of his 3-year DM course. So, sir, thank you for giving us your valuable time and welcome to the program. And over to you, sir.
Thank you, Chandan. So, as you know, this is a kidney week, and we are going to celebrate on 10th of this month as World Kidney Day. And the topic, as we know, that is kidney health for all. That is the theme of this Kidney Health Day, to bridge the gap for better kidney care. So, and my topic is also basis on this only. So, my topic of prevention of kidney disease, and we know that kidney disease, as we know, very few people have knowledge regarding the kidney disease. Most of the people are generally ignorant. What? How can we prevent the kidney disease? Many have different type of question, that how can prevent it, what is the diet, so and so. So my focus today will be how to prevent this kidney disease. First, I'm going to speak few words kidney. As you know, what is kidney? Kidney, as you know, is a very vital organ of the body, and it is a bean shaped structure located in the loin area. And for normal functioning of the body, one kidney is sufficient. Most of the people have doubt that whether my one kidney is working or not, my whether my both the kidney has been affected or single kidney has been affected. So I want to clear that one kidney working, one normal working kidney is sufficient to sustain a normal life. So we know what is kidney. Kidney, what are the main function of kidney? We should know little something about what is the normal function of a kidney. Kidney, as we know, kidney has important organ for removing the waste material of the body, or urine formation, as all of them know that it is an important organ for urine formation and remove the waste. And many of the things people doesn't know, that it is a very important organ for controlling of our blood pressure, and it is also a very important organ regarding maintenance of our electrolytes in our body. It also helps in maintaining the bone health, and also it is an important organ regarding the formation of blood in the body. So these are the few important things regarding the function of a normal kidney. And what happens if the kidney is affected? If kidney is affected, these all parts are seriously get affected, leading to your decreased urine formation, increased waste material in your body, leading to uremic symptom like that. There is a decrease in the hemoglobin level of the body, and there is also affected in the bone health. So these are the few symptoms regarding the when the kidney got affected. There are two types of kidney failure, that is acute kidney injury, and one is chronic kidney injury. And acute kidney injury is basically a temporary malfunction of a kidney leading to decreased function of the kidney, where the patient may require dialysis or may not require dialysis. And other is the chronic kidney disease. Here, the kidney damage is permanent. So our focus today is on chronic kidney disease. And here we have to know one important thing, that chronic kidney disease is a generally most of the people of the chronic kidney disease present to us very late. I will like to highlight few things about chronic kidney disease. There are few stages of chronic kidney disease. We should. I will try to explain as short as possible. Chronic kidney disease has five stages: stage 1, 2, 3, 4, and 5. In stage 1 to 3 stages, there is generally no symptom, and most of the patients are unaware of this. So are most of the target is this group of patient from kidney stage 1 to 3. So how you are classifying these kidney different stages, stage 1 to 3? It is basically done on the basis of GFR. What is GFR? GFR is glomerular filtration rate. So how can you calculate this glomerular filtration rate? It's very easy, and many of the and it is generally calculated by the on the basis of serum creatinine value, age of the patient, sex of the patient. Generally, these 2 to 3 parameters are required to know the what is the glomerular filtration rate of the kidney. Stage 1 to 3, generally the GFR is on the higher side, that is more than 30. If the GFR of the kidney is more than 30, and if the patient is in stage 1 to 3, generally there is no symptoms, and most of the people are undiagnosed. They generally come to us in the stage when they present with other symptoms, then or incidentally diagnosed. So, and whereas in the stage 4 and 5, they generally have symptoms of kidney disease, such as uremic symptom, such as there is lack of appetite, there is complaint of weakness, there is presence of anemia, there is decreased hemoglobin leading to anemia. Then the patient may present with pedal edema or decreased urine output like that. And these are the complaints for which the patient present to us, but it is a very late stage, that is 4 and 5. There is severe damage of the kidney, whereas in the mild damage of the kidney, there is generally no symptom. There is up to 90% of the, if the kidney is damaged, up to 90% also, patient may or may not have any symptom. If the damage is more than 90%, that is, the patient is in the stage 4 and 5, generally there is a lot of symptoms, and it is very difficult to prevent the kidney at these stages. So we should know which are the group of the patient are more likely to develop this kidney disease. You should know that in every 3 patient of kidney disease, 1 patient have high risk of developing kidney disease, and 1 out of every 5 patient of the hypertension have chance of developing kidney disease. So these 2 group of patients, that is diabetes and hypertensive, these constitute around 50 to 60% of the kidney disease in India, and also in the outside of India, in other countries also. So these 2 are the most important risk factor for development of chronic kidney, that is diabetes and hypertension. There are also few other disease where there is an increased risk of chronic kidney disease, such as if there is any family history of kidney disease, such as polycystic kidney disease or other autoimmune disorders, where there is also a risk of kidney disease. If the patient is suffering from heart disease also, there is also a risk of kidney disease. And other few risk factors also include if the patient is very old age, that is age is more than 60, or there is repeated urine infection. These are the also few risk factors where the patient may develop kidney disease. So these are the few of the risk factor where the patient have chance of development of kidney disease. So how can we prevent this kidney disease? First and important is how to diagnose this kidney disease. Generally, there are very 2 to 3 very easily tests available everywhere. We can diagnose the kidney disease. That is, first is the urine routine. Urine routine can be done each and every lab near about in every places. We can easily do the urine test and look for any presence of any protein in the urine, where we can detect whether there is a proteinuria is there, or any RBCs are there, or any other abnormality is there. And also we can test a simple urea creatinine test, where we can detect any presence of kidney disease is there or not. Or we can do an ultrasound, where we can look whether there is any abnormality is there, whether the patient is having single kidney, or whether the size of the kidney is small. So these 2 to 3 tests can generally detect more than 95 to 96% of the chronic kidney disease. So this patient, as I have mentioned, that diabetic, hypertensive, or previous history of kidney disease, or family history of kidney diseases, or patient having repeated infection, this group are the target group, and they should regularly do this test so that they can detect the chronic kidney disease in early part of the early stages of the kidney disease. So this important group of tests should be done in this group of patient, as I mentioned, that is hypertensive, diabetes. So by this we can easily detect the chronic kidney disease in very early stage of the patient.
Sir,
So
I would request you if you can give this message in the local Odia language as well for the benefit of local patients. It will be
Okay,
really
okay,
nice.
okay, okay. So I will use Odia also.
Yes, sir.
That's
Yes,
it.
sir.
I will restart in Odia or I will
No, no,
continue.
you can continue from here, sir. No
हाँ
problem.
so ମୁଁ so ଆମେ ଜାଣିଛୁ କି କିଡନୀ ଡିଜିଜ ଟା and ଆମର ଏଇ ଓଡ଼ିଶାରେ ବେସିକାଲି କେତେଟା ଏରିଆ ଅଛି ଯୋଉଠି କ୍ରନିକ କିଡନୀ ଡିଜିଜ ବହୁତ କମ ଅଛି। So এটা ଗୋଟେ ମାନେ particular group of disease that is ମାନେ ଆମର ଏଇ ଓଡ଼ିଶାରେ କିଛି ଜାଗା ଦେଖା ଯାଉଛି ଯୋଉଟା କି western ଓଡ଼ିଶା କି ଆମର କଟକରେ କିଛି ଏରିଆ ଅଛି and also ମାନେ ଓଡ଼ିଶା ବାହାରେ ବି ଅଛି। ତ ଏଇଟା ଜେନେରାଲି ଆମ ଚାଷୀ ଭାଇଙ୍କର କେସରେ ବେଶୀ ଦେଖାଯାଏ ଯୋଉଠି ମାନେ ସେମାନେ ଯୋଉମାନେ ଖରାରେ କାମ କରୁଛନ୍ତି ଇଏ କରୁଛନ୍ତି ଡିହାଇଡ୍ରେସନ ହଉଛି ପାଣି ସଫିସିଏଣ୍ଟ ପିଉନାହାନ୍ତି ତ ସେ କେସରେ ଆଉ ସେମାନଙ୍କୁ ବି କ୍ରନିକ କିଡନୀ ଡିଜିଜ ହଉଛି ଗୋଟେ ଗୋଟେ ଡିଫରେଣ୍ଟ ଟାଇପ କ୍ରନିକ କିଡନୀ ଡିଜିଜ ହଉଛି ଏମାନଙ୍କୁ ତାଙ୍କର ସୋଡିୟମ କମ ରହୁଛି ପୋଟାସିୟମ କମ ରହୁଛି ଏଟା ଗୋଟେ ଡିଫରେଣ୍ଟ ଭେରାଇଟି ଅଫ ଡିଜିଜ ଆଉ ସେମାନେ ଏଇ ଜିନିଷଟା ଜାଣି ପାରୁନାହାନ୍ତି ଆଉ ଯେତେବେଳେ ଡ୍ୟାମେଜ ଟା ବେଶୀ ହେଇଯାଉଛି ସେ ଆମ ପାଖକୁ ଆସୁଛନ୍ତି ତ ତାଙ୍କୁ ବି ରେଗୁଲାରଲି ଡକ୍ଟର ପାଖକୁ ଟଚ୍ ହେବା ଦରକାର कि कौन डायट हेबा दरकार कौन केते अमाउंट रे पानी पीवा दरकार ताकि तांकर क्रोनिक किडनी डिजीज टा नॉर्मल ग्रुप ऑफ डायबिटीज हाइपरटेंसिव जो रहउची तांकर तो पूरा टोटली टा डिफरेंट रहउची तो तांकर डायट तांकर प्रिवेंशन इज टोटली डिफरेंट तो से माने जो गां गां रे जो जोरे क्रोनिक किडनी डिजीज रहउची जा कॉज एबे भी जणा नाही से माने आसी कि डॉक्टर पाखु जत्ते जल्दी होउची प्राइमरी केयर फिजिशियन और लोकल हॉस्पिटल और नियर बाय नेफ्रोलॉजिस्ट को देखिया कथा ताकि तांको डिजीज प्रोग्रेशन को स्लो करि परिबा काहे कि तांको डिजीज प्रोग्रेशन इज नॉट फास्ट एज कंपेयर टू डायबिटीज सो तांको हम डिजीज प्रोग्रेशन भी स्लो करि परिबा सो मु माने इंपोर्टेंट जिंस गुडा कहिबी जोडा सब important for prevention of kidney disease such as ସବୁଠୁ most important ରହିଲା diabetes or hypertensive patient ରେ control of the blood sugar in the normal range ରଖିବାର ଅଛି regularly HbA1c test କରିବାର ଅଛି ट्राए करिवे वर्षକୁ 4 थर टेस्ट करिया पे HbA1c नहले मिनिमम 2 थर ट्राए करिवे जे जते परिबे टारगेट शुगर लेवल को रीच करिवे आ लोकल डॉक्टर पाखु रेगुलरली चेकअप करथुबे आ हाइपरटेंसिव पेशेंट रे टारगेट ब्लड प्रेशर रखिया कथा ट्राए करिवे बीपी 140/90 ରୁ ତଳକୁ ରଖିବା ଚେଷ୍ଟା କରିବେ ନହେଲେ ଆଉ ରେଗୁଲାରଲି ଡକ୍ଟର ଫଲୋ କରିବେ କାହିଁକି ସବୁ ବ୍ଲଡ ପ୍ରେସର ଟାର୍ଗେଟ ସବୁ କ୍ଷେତ୍ରରେ ସେମ୍ ନୁହେଁ ପେସେଣ୍ଟ ଟୁ ପେସେଣ୍ଟ ଭ୍ୟାରି କରୁଛି ତ ବ୍ଲଡ ପ୍ରେସର ଆଉ ବିପି କଣ୍ଟ୍ରୋଲଟା ସବୁଠୁ ଫାର୍ଷ୍ଟ ରହୁଛି ଆଉ ଗୋଟେ ହେଲା ଲିପିଡ ପ୍ରୋଫାଇଲ ବି ବହୁତ ଇମ୍ପୋର୍ଟାଣ୍ଟ ରହୁଛି ତାଙ୍କ ଚେଷ୍ଟା କରିବେ ଯେତିକି ହେବ ତାଙ୍କର କୋଲେଷ୍ଟ୍ରଲ ବି ପ୍ରପର ରେଞ୍ଜରେ ରଖିବା ଚେଷ୍ଟା କରିବେ ଆଉ ବହୁତ ଇମ୍ପୋର୍ଟାଣ୍ଟ ରହୁଛି ସ୍ମୋକିଂ ର ବି ବହୁତ ଇମ୍ପୋର୍ଟାଣ୍ଟ ରୋଲ ରହୁଛି ସ୍ମୋକିଂ ହେଲେ दे इंक्रीज रिस्क ऑफ माने हार्ट डिजीज ब्लड प्रेशर भी बढ़ी जाए तो जेते पारिबे स्मोकिंग स्टॉप करिवे तो स्मोकिंग को भी बंद करवाटा बहुत इंपोर्टेंट दरकार रेगुलरली चेकअप करिवा दरकार रेगुलरली फिजिशियन पाखु जिबा दरकार रेगुलरली ब्लड चेकअप करिया कथा आउट इंपोर्टेंट होची वाटर इनटेक शुड बी सफिशिएंट around 3 liter minimum 3 liter of water is should be taken by normal patient and until and unless the patient having chronic kidney disease the माने पानी इनटेक टा सही कैसे अलगा रहबा बट नॉर्मल इंडिविजुअल ले जार क्रिएटिन नॉर्मल अछि जार अदर फंक्शन बॉडी नॉर्मल अछि मिनिमम 3 लीटर्स ऑफ फ्लूइड पीवाटा बहुत दरकार और जति आउट इंपोर्टेंट होला टू कीप हेल्दी एक्सरसाइज भी बहुत इंपोर्टेंट रहउची जो डायबिटिक हो के हाइपरटेंसिव हो नॉन डायबिटिस भी नाही कि हाइपरटेंसिव भी नाही एक्सरसाइज टा रेगुलर हबा दरकार एक्सरसाइज रेगुलर करले এই सब किडनी डिजीज रा रिस्क भी कम होछ मिनिमम 30 मिनिट्स ऑफ एक्सरसाइज करिया कथा पर डे पारले सप्ताह मिनिमम 5 दिन करिया कथा आ जेते पारिबे इफ आपन बॉडी अगर वेट बेसी अछि आपन ओवरवेट अछंती तो वेट को कमेवा चेष्टा करिवे कि ओवरवेट आल्सो लीड्स टू हाइपरटेंशन ओवरवेट हेले बेसी हाइपरटेंसिव रिस्क रहउची डायबिटीज रो रिस्क रहउची इनडायरेक्टली क्रोनिक किडनी डिजीज रिस्क रहउची आउ आउट इंपोर्टेंस रहिला लूण कम खाइबाटा हमर इंडियन सेटअप रे पेशेंट कर मोस्ट ऑफ द पेशेंट ताकर सॉल्ट सेंसिटिव हाइपरटेंशन रहउची माने सॉल्ट जतकी बेसी खाइबे ब्लड प्रेशर हेतकी बढ़िया चांस अछि तो जेते पारिबे सॉल्ट रेस्ट्रिक्शन डाइट खाइबा चेष्टा करिवे अंटिल अनलेस तमर ब्लड प्रेशर लोअर साइड रे रहउची माने सॉल्ट रेस्ट्रिक्टेड डाइट माने गोटे चम्मच लूण खाइबे ता माने होची 5 ग्राम लूण खाइबे आउट हैला मोस्ट ऑफ द जेते पारिबे फ्रूट्स एंड वेजिटेबल रेगुलरली खाइबे दिन को माने मिनिमम 3 थर 4 थर फ्रूट्स वेजिटेबल्स खाइबे एतरे कोन हेबो आपनकर एतरे फाइबर कंटेंट बेसी थाए कॉन्स्टिपेशन चांस भी कम अछि आ आपनकर बॉडी रो गट माइक्रोबियोम भी भल रहइबो सेतरे कोन हेबो इन्फ्लेमेशन चांस भी कम रहइबो तो आपको जेति परिबो फ्रूट्स वेजिटेबल बेसी खाया कथा ଆଉ ରେଗୁଲାରଲି ବଡି ଚେକअप କରିବା କଥା। ଆଉ ଗୋଟେ ରହୁଛି ବହୁତ ପେସେଣ୍ଟଙ୍କର ଡାଉଟ୍ ରହେ କି किडनी स्टोन केमती हम प्रिवेंट करि परिबा काहे कि रिपीटेड स्टोन्स एंड रिपीटेड इन्फेक्शन आल्सो लीड्स टू क्रॉनिक किडनी डिजीज माने रिपीटेड स्टोन हेले रिपीटेड इन्फेक्शन हेबो जोटा हमकु किडनी डिजीज करि परिबा। तो सेमती द किडनी स्टोन प्रिवेंशन रे बहुत इंपोर्टेंट हैला सफिशिएंट अमाउंट ऑफ वाटर इनटेक माने मिनिमम 3 रु 3.5 लीटर पानी पीवा कथा और हेई परिबा बोले ऑक्सालेट रिच फूड अवॉइड करिया कथा। ऑक्सालेट रिच फूड कोन पालक रोची तमर ऑक्सालेट रिच फूड नॉन वेज आइटम रोची ऑक्सालेट रिच फूड एटा हम जेति परिबो अवॉइड करिवो। तो एटा हला किछि इंपोर्टेंट टिप्स रोची रिगार्डिंग प्रिवेंशन ऑफ chronic kidney disease। तो मु आउथरे कहि दोछि chronic kidney disease इंपोर्टेंट जनरली सबुतरु इंपोर्टेंट रोची निजर बीपी कंट्रोल इन केस ऑफ हाइपरटेंशन sugar control in case of diabetes and other patient जार माने रिस्क फैक्टर रोची जार जंती हार्ट पेशेंट रोची से मानकु रेगुलरली एवरी ईयर मिनिमम 2 थर ब्लड टेस्ट करबा अछि रेगुलरली डॉक्टर फॉलो अप करबा अछि एमती नाही कि आज मेडिसिन खाइ देलो वर्ष 2 वर्ष पे चेकअप करिवो। Regularly means every 3 to 4 months they should visit a nearby doctor or they consult the doctor to whom they are consulting frequently। तो डॉक्टर को देखिवाटा रेगुलरली वेरी इंपोर्टेंट और रेगुलर टेस्ट बेसी इंपोर्टेंट इन माने सो दोज ग्रुप ऑफ पेशेंट वो रिस्क फैक्टर जार रहउची तांको रेगुलर फॉलो अप करिवाटा और रेगुलर टेस्ट करवाटा बहुत दरकार काकि केते बेले किडनी डिजीज आसीबो किहे जानि परिबनी। तो एई जो अर्ली स्टेज ता जोडा म कहली स्टेज 1 रो 3 सेटा धरिया पई रेगुलर चेकअप इज द ओनली टूल माने एथु ही हमें जानि परिबा कि तार किडनी डिजीज अछि कि नै काहे कि वन स्टेज 1 रो स्टेज 3 भितरे किडनी डिजीज धरिबाटा वेरी वेरी डिफिकल्ट अंटिल अनलेस इंसिडेंटली हमें टेस्ट करछु। तो एई स्टेज को जते जल्दी हमें धरि परिबो सेतकी जल्दी हमें हमें किडनी डिजीज को प्रोग्रेशन को हमें डिले करि परिबो। तो हमें जतकी रेगुलरली फॉलो अप करिबा और टेस्ट करले ही हमें किडनी डिजीज को धरि परिबा। आउट रहला डाइट रे हमें जते परिबो पानी एक्स्ट्रा पीबू जते परिबू 3 3.5 लीटर पानी पीबू स्मोकिंग अल्कोहल अगर पिउचंती तो अल्कोहल रेस्ट्रिक्ट करिवू आउ रेगुलर डाइट ठीक टाइम रे खाइबू जति परिबू फ्रूट्स वेजिटेबल जते खाइले सेते बेटर और रेगुलर एक्सरसाइज करला ही हमें किडनी डिजीज को प्रिवेंट कर दो। हमें किडनी डिजीज को पूरा तो बंद करि परिबानी बट किछि हद तक हमें ताकू जो हेइ जाइछि ताकू प्रिवेंट माने हमें डिले करि परिबा और जोटा अगर हेबार चांस अछि तो हमको ताकू स्लो करि परिबा ताकि हमर जो नॉर्मल लाइफ जो एक्स्ट्रा लाइफ ता हमें ताकू बढ़े परिबा। सो एई जो किछिटा फ्यू टिप्स जो मु कहली 7 10 टा टिप्स कहिछि सेटा को हमें फॉलो करले हमें किडनी डिजीज को प्रिवेंट करि परिबा। हमें पूरा तो बंद करि परिबानी बट हमें प्रिवेंट करि परिबा। सो एतकी ही अछि माने प्रिवेंशन ऑफ किडनी डिजीज। आउ आउ किछि कहा क्वेश्चन रहउछि तो मु आंसर करिवि इफ देयर इज एनी क्वेश्चन।
Yes, sir. There is a question. How much salt a dialysis patient can intake in a day?
एक्चुअली सॉल्ट हला लेस देन 5 ग्राम पर डे आइडियली 5 ग्राम रु कम सॉल्ट ही देबा कथा जति 1 टीस्पून ऑफ सॉल्ट।
Okay. Then we have a question. How fast a kidney can pass stages? And should newly diagnosed diabetic patient worry?
Actually, it is very difficult to predict how fast the kidney disease can progress because in diabetic patient, actual status can only be known by biopsy, and serum creatinine is not always the correct marker of the kidney status. So it is very difficult to predict in case of diabetic patient compared to non-diabetic patient.
Okay. And sir, what is the role of nutrition in dialysis patients?
So in dialysis patient, nutrition plays a very important role because if the patient intake of protein is inadequate, it can lead to increased malnutrition. It can aggravate the inflammation and which can increase the mortality of the patient. So adequate protein nutrition is very important in dialysis patient. That is protein intake of near about 1.2 gram per kg per day of protein is required, and sufficient amount of fiber intake is also very important. That is up to 30 gram a day of fiber is very important for prevention of further inflammation of the body.
Okay. So these were the questions. Any other message, sir, which you would like to give for the benefit of the patients? Because this is the World Kidney Week is going on, and I think the patient should get benefited from this message a lot. So any other message you would like to give, sir?
I will like to give the message that if possible, try to visit the nearest hospital, to the nearest doctor to get your kidney checkup as quickly as possible, because it is very difficult to know the kidney in the early stages, as I have mentioned. So it is better to get checkup. Otherwise, it is too late if the patient come in the very later stage of the disease. So it is better to get checkup than to wait till the patient lies up in kidney failure.
Okay. So, sir, thank you very much for giving your very precious time, and I think this message will go to many patients, and they will get benefited out of it. We just have one more question, sir. What nutrients affect kidney function?
Actually, regarding the nutrition, heavy increase excess amount of animal protein can affect kidney adversely. So, if the patient is having compromised renal function, we generally advise the patient to take more amount of plant protein, which contain increased amount of alkalis, which is good for kidney. And we generally avoid animal protein in this group of patient. And generally, high increased amount of fruits. Uh, Consumption can lead to hyperkalemia, which is also bad for a CKD group of patient. Whereas in normal group patient, this potassium is good for health. So we have to keep in mind the type of protein we are providing the CKD patient. That is very important, because animal protein is generally harmful for the kidney.
Okay. And even for the dialysis patient, animal protein is
No,
harmful,
for
sir?
dialysis it is different. For dialysis, we required high amount of protein with high biological value, where animal protein is best protein in case of dialysis patient. It is
Okay.
compared to CKD group of patient.
And how much protein is required for the dialysis patient, sir, generally?
It is 1.2 gram per kg body weight in dialysis patient on hemodialysis, and up to 1.5 gram per kg in peritoneal dialysis patient.
Okay. Thank you, sir. Thank you. Thank you very much for giving your valuable and precious time. And I hope this message passes on to a lot of patients and they benefit in the World Kidney Day.
Thank you.
Thank you, sir. Thank you and good night.